Let's talk about health insurance renewal decisions. Whenever you're using a big box traditional health insurance carrier, whenever your premiums go up, as an employer, you're limited in what you can do to help bring those costs back down. You can move to a more limited network, going from a PPO plan to an HMO plan or a more restricted network. You can raise deductible levels, so going from a $3,000 to a $5,000 deductible. You can increase the employee plan cost, so increasing what the employee contributes to the plan whenever they elect health insurance. And then the last one is you can really just look to change carriers, right? So there's a cost of change to all of these things, but these are the two that I really kind of want to focus on. Whenever you increase the employee plan cost, that decreases the employee's net pay, right? So they're going to make a little bit less money, but if you also have to raise deductibles here, the financial barrier to care has now been increased because now it costs more whenever they seek higher services above, like a primary care visit or something like that. These options here, they don't actually help solve the problem and give you control over the reason why your premiums continue to go up. All you're doing here is really just pushing cost. And like I said, that does not solve the problem. Because if people make less because they're paying more for health insurance, and or it costs more for them to use their insurance, that financial barrier to care is going to stop them from getting preventative services done that they need to have done. And what that does is that increases your risk in the future because you're not going to be able to catch early cancer. Instead, you're going to catch it whenever it's stage 3 instead of stage 1. And that's just one example of that. If you actually want to make a real change, you have to gain control over your health plan and what you're doing. The way that you do that is by implementing cost containment tools. And whenever you do something outside of fully insured, you're given more plan flexibility. And the biggest thing around all of this is making sure that the partners within your health plan are aligned for your benefit. If they financially benefit whenever you spend more, then they're not aligned with the overall success and long-term strategy of your business. One of the things that you have to remember in all of this is that your premiums as an employer, especially with a big box national health insurance carrier, your premiums is the carrier's revenue. And the carrier loves it whenever you make these decisions here, because all this does is it makes you more profitable to them. So as long as you keep making these decisions here, you're never going to actually gain control and start to lower the cost of your health plan. You have to be able to get control, you have to be able to put cost containment methods, and you have to be willing to break away from this traditional approach that is built to cost you more.